Hello everybody and welcome to a lower body mobility class. I'm Dr. Weber. I'm going to take you through some toes, some ankles, some knees, and some hip work. What we're going to start today is with our toes, so you can start standing or you can be seated like this. Okay, so you can do this either seated or standing. And what you're going to do is first begin by pressing the big toe into the ground and try to bring the lateral four toes off of the ground. Okay. Again, if we're standing nice and tall. You can look down here. If you're sitting, all four toes, lateral four toes are off the ground, squeezing that big toe into the ground. Hold it for 5 more seconds. 4, 3, 2, and 1. Now the big toe up, small toes down. If you're standing, just squeezing those fists, big toe up. Now big toe down, small toes up. Try to separate those toes while they're up in the air. Now from here, big toe up, small toes down. Hold 5, 4, 3, 2, and now all toes up. I want you to squeeze your core, squeeze your glutes, squeeze your chest, squeeze everything. And I want to get those toes up as high as they'll go without deviating the foot in or out. So trying to get all 10 toes up off the ground as high as they'll go. Squeeze all your muscles here. Now I want you to squeeze all 10 toes into the ground. Again, squeeze your core, squeeze your arms, squeeze everything. Toes into the ground. Now big toe up. Again, squeeze your whole body, 50% effort. Now big toe down, small toes up. Squeeze your body. Try to get those toes up. And then relax. Okay. Now with the toes, we're going to try to piano them down. So one toe at a time, we're going to piano them down. So pinky all the way to big toe. Okay, pinky all the way to big toe. Pinky all the way to big toe. Try to control it one toe at a time, pinky to big toe. One more time, pinky to big toe. Now, the last thing we're going to do, again, you can do this seated or standing. We're going to take all 10 toes up off the ground. And now we're just going to press that big toe into the ground. 5, 4, 3, 2, and 1. Okay. Now we just controlled those toes. Now we're going to get into the ankle. So I'm going to teach you some ways to mobilize and to also train mobility in the ankle and foot. So there's ways you can mobilize the bottom tissues of the foot. You can use lacrosse balls, tennis balls, and you can just apply a little bit of pressure in those areas just to get some mechanoreceptor stimulation into those areas. Okay, this isn't going to improve your mobility, but it's going to at least tell your kind of nervous system where inputs may need to go. Okay, so looking for any pain, unusual tightness, or anything like that. Tightness meaning more of a neurological indicator of feedback. So there's a set spindle tone that your joints create by way of the nervous system that either tighten or loosen the muscle tissue. Now, it can be tightened if there is lack of mobility and lack of capsule space. So if there's no capsule space, the capsule won't allot muscle spindle to the tissue in order for it to move appropriately in the right way. So in order to actually train mobility of the ankle and foot, we can use a kettlebell, okay? Lay it on its side. What we're going to do is stand on the outside of the kettlebell with the outside of our foot, the lateral aspect of our foot, and press the medial portion of the foot into the ground, okay? From here, I'll move this up so you can see that a little bit better, okay? So I'm going to press the lateral portion of my foot into the kettlebell. Okay, so what I'm doing here is I'm everting the foot, right? the outside of the foot is leaving the ground. You're going to feel the tissue in the side of the leg, lower limb, beginning to activate. And you'll just hold here and breathe for about 2 minutes. Inhale for 4, exhale for 8. Okay, you're just stretching out the tissue to start. Now, if you can't get into this position, or you need to maybe find a different object, you can just try to find a slant board. Even if you cut a piece of wood out, or if you know a carpenter who can cut a piece of wood out so you can have a almost like a ramp, you could stretch your ankle out like that. And then from here, we'll start pressing the outside of the foot into the kettle. We'll try to keep the medial aspect of the foot on the ground. So we'll try to now we're going to try to supinate the foot while we're everted, right? So we're going to press into the kettle, 10%, 20%, 30%, 40%. And then after about 10 seconds of holding your max effort, we begin to evert the foot even further, trying to lift the foot away from the kettle. And you'll feel all the tissues in here working here, going up off of the kettle and then back to your passive stretch. Okay, so that would be for foot eversion. Okay, now for foot inversion, okay, that was eversion. Now this would be inversion of the foot. So the foot is everted. We would stretch in the everted position here for about 2 minutes. Again, a slant board. You could use a slant board. You could even maybe just create a barrier yourself. If you have a kettle, this will do. And we're inverted. Foot is inverted here, stretching passively for about 2 minutes. And then your PALS effort, progress the angle by trying to evert the foot. So pressing the inside of the foot into the kettle, 10%, 20%, squeezing the whole body, 30% to 40%, all the way to your safest and greatest effort. And then trying to lift or invert the foot even deeper for your rails contraction. Okay, so that would be PALS and rails for foot or ankle eversion here and inversion. Now, same thing on the other side, I could do it. And again, I'm just kind of going over real quickly, but at the same time, if you're going over at the same time as I was, you're still getting a kinetic effect. Okay, so it's still important you could do a exercise called passive range liftoff, where you're going to go into your passive range, and then from here, you're just going to see if you can lift the foot off of the kettle and hold. 5, 4, 3, 2, and then set it back down. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. Set down. Foot inversion, passive range lift off. Inhale, irradiate, lift off. 5, 4, 3, 2, and set down. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. One more. Inhale, radiate, lift off. 5, 4, 3, 2, and 1. Okay. For foot eversion, passive range lift off. Foot is everted. Inhale, irradiate, attempt to lift off for 5, 4, 3, 2, and relax. Hold. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. Notice that the knee is going to want to cave inward and cheat for the ankle. Try not to let that happen. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. So even if it doesn't lift off, you can attempt to lift off, noticing that the knee valgus there is cheating for the ankle. Okay, so if you don't have good ankle strength, you'll notice that your knees will do some of the brunt. Okay, for the big toe, a lot of people are limited in big toe extension. Now, big toe extension is really important because you use it when you walk, but now our feet kind of do the walking for us, so we lose the contact with our toes to the earth. So what that means is we actually have to train our toes to be human again. Now, what does that mean? That means that we need to be able to, one, be able to move those toes independently, and then also making sure that we have, importantly, the most extension of that big toe. Why? Because if you don't have big toe extension, your big toe will deviate medially or laterally. And what will happen is you'll get a bunion on the medial aspect of your foot here. So the more these foot go in, or more the big toe goes inward, the more you're going to have arthritis in the toe, and then you'll have a bunion. So if you can't move that toe now, you want to begin moving that toe as much as you can to limit that diagnosis in the future. So that's why we prescribe you to do your morning calves routine or your toes routine every single day. But also, if you can't move these toes independently, or if you're trying to control these toes, then you want to try to add positional isometrics. You can do passive range liftoffs from here. So passive range liftoff for big toe extension, you put the big toe on a barrier, and then you would try to take an inhale, irradiate, and then try to lift off. 5, 4, 3, 2, and 1. You could also do that with a tennis ball. Okay, trying to find your end range. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. Inhale, irradiate, lift off. 5, 4, 3, 2, and 1. Reset. Inhale, irradiate, lift off. 5, 4, 3, 2, and bring it back down. Okay, so that would be big toe passive range lift off for the big toe. Okay, or we can also call that regressive angular load. Okay, trying to regress the angle, creating that isometric load in that angle by using the passive range. All right, so there's the toes, ankle inversion, ankle inversion, or eversion and inversion. Now we can talk about the knee. So the knee flexes, extends, internally and externally rotates. Okay, so the knee is responsible for flexion, extension, and there's also tibial rotation here. So in tibial rotation, what you want to do is first set up by placing the hands behind the body like this. Okay, give yourself some support. If you have blocks, you can use blocks, but probably don't need that right now. From here, if you're in a chair, you can do the same thing. Okay, if you're in a chair, I'll give you an option. Okay, do the same thing. Okay, it's going to look like this. Okay, I'm about to teach you what that is right now. So now we're going to go to the knees, bring our hands behind, give us some support. I want you to flex the knee, press this front foot into the ground, and then what we're going to do is try to rotate that foot out and then rotate that foot in. Internal tibial rotation, external tibial rotation. Now, I don't want you to move the hip when you do that. So in and out. Only thing that is moving is the shin bone. In, out. And then from here, I want you to wrap your hands underneath the leg if you have the balance. If not, you can keep your hands here. And then we're going to extend the knee, turn in, and then bend the knee. Out, extend, in, bend. Out, extend, in, bend, in and up, out and down, in and up, out and down, in and up, out and down. Okay, other side, bend the knee, external tibial rotation, internal tibial rotation, external and internal, or out and in, out. Now up or extension, in and down or flexion, out, up, in, down, out, up, in, all the way down. Now in and up, out, and all the way down. Squeeze it down, in and up, out, and down, in, up, out, and down. Okay. Now for tibial rotation here, I can set up a barrier in external tibial rotation. So what I'm doing is getting into a dorsiflexion of the ankle, flexion of the hip, and then flexion of the knee. And then from here, what I'm going to do is rotate the tibia out and place that ipsilateral hand across the medial upper portion of the foot. Okay. And then from here, or the medial distal portion of the foot. All right, now with that portion of the foot, I'm going to hold it nice and steadily here. I'm going to wrap those 4 fingers underneath and push the thumb into the middle of the foot. And then from here, I'm going to open up this whole foot and leg, so you should feel maybe a little stretch on the inside of the knee. If you feel pain, then we probably won't do this today. So this would be something you might want to skip. If you feel any pain during this, please do not attempt it. Okay, if there's no pain, then let's go ahead, and what we'll do is just stretch this position. I'm going to take my opposite hand or contralateral hand underneath and place it on the palmar flexors or the top of the forearm. Okay. From here, what I'm going to do is stretch and breathe. Inhale 4, exhale 8. After about 2 minutes of work, I will begin to, or after about 2 minutes of passive holding and breathing, diaphragmatic breathing, inhale 4, exhale 8. Then I'll begin to start pressing that foot into the hand. Now, what do I mean by that? I'm going to try to internally rotate at the tibia in toward my hand. So that hand is the barrier, but I'm going to hold on so tight that it's not going to move. So that's going to create the isometric contraction. That is our PALS contraction, progressive angular isometric load. So that's what we're doing here in end range of external tibial rotation, holding, breathing, inhale 4, exhale 8. And then from here, after about 2 minutes, we will begin to internally rotate. You'll feel some tissues in and around the lower leg here beginning to contract. 5%, 10%, 20, 30, 40, 50, 60, 70, all the way to your safest and greatest effort that has 0 pain for 5, 4, 3, 2, and now we're going to try to go deeper into external tibial rotation by doing a passive range liftoff from here, trying to pull that foot away from the hand, keeping everything nice and intense. 5, 4, 3, 2, and 1. And we'll wrap that hand around. Go back to your passive breathing. And you might have felt a lot of tissue kind of lighting up in those pals and rails. That's perfectly normal. Pain is not normal, so any type of pain, I would definitely tell you not to do this today. Okay, so this would be external tibial rotation here. Now, internal tibial rotation, I would take the contralateral hand to the distal lateral portion of the contralateral foot, and then I would place the opposite hand around underneath to the forearm. Okay, now what I would do here is stretch and breathe for about 2 minutes. As you see, I'm from here, external tibial rotation, internal tibial rotation, set up here. This is my passive range hold, or passive range, passive breathing, I guess, stretch for 2 minutes, I guess you could say. And then we begin our PALS effort and then our RALS effort, okay? So passive breathing, inhale 4, exhale 8 for about 2 minutes. And then from here, pressing the outside of the foot into the palm, 10%, 20%, 30%, 40%, 50 to 60, 60 to 70, and then holding your safest and greatest effort for up to about 10 seconds, and then trying to lift away from the hand after your PALS contraction, so almost like a passive range liftoff, holding 5, 4, 3, 2, and 1, and then back to your passive range. Now, if that's your first time doing that, you're going to feel a lot going on in these lower limbs, and that's why you probably don't want to do it. You probably don't want to passively hold it for too long and do the PALS and RALS for too long when you first start. So I would recommend doing like just a quick, 30-second setup to like see how you feel here. Can you get into this position without pain? That would be prerequisite number 1. Can you externally and internally rotate your tibia? That would be probably actually number 1. But you want to make sure that you have control before you get into these ranges. If you can't rotate and there's pain, then I would prescribe not to do internal and external tibial rotation PALS and RALS, because this one is definitely more difficult and it can cause a lot of stress on the knee, okay? So as stress pushes into the knee, you're also going to get a lot of, I guess, bang for your buck, meaning that you're going to actually prevent knee injuries if you're able to create more strength in that end range, okay? Now, that is something that I would prescribe to somebody if I was working with them, and if you needed that prescribed for you, you'd have to make sure that you talk to FRC practitioner first, because you never know. A lot of people can get injured just through going through some of these PALS and RALS. So the setup on the other side look like this. So we have external tibial rotation. Again, you'll feel that stretch here. If you have any medial knee issues, you're definitely going to notice it if you do this. If you have lateral knee issues, you're definitely going to notice it when you do this, okay? So this would be our lower limb, and this would be tibial rotation. So for knee flexion, what you can do is set up and bring your head underneath a yoga block. And bring my hand to my foot. I can also go onto my stomach like this, and I would hold this position for about 2 minutes. Now, if I can't reach my ankle, I can always use a stationary object like a wall or even a chair to put my foot, okay? Now, if I can't reach it, I can also just use a wall or a chair, okay? And then from here, I'm stretching, I'm breathing. And what I would do from here, if the chair isn't working, you can also use a wall, like I said. So let me show you how that would work. Okay, so the wall set up. Okay, got the top of my foot on the wall. And then from here, passively hold, inhale 4, exhale 8. The PALS contraction, be pushing the foot into the wall, trying to extend the knee. Then RALS contraction, pulling the heel toward the glute, okay? So again, if you don't have a wall, what is that? What did I do? You don't have a wall, you can take a towel or a rope or some type, maybe even a band, and hold it here, and then create those contractions. PALS trying to extend, RALS trying to pull the heel toward the glute. So I could do a double version where PALS trying to pull, Ral's pulling, heel toward the glute. Okay, so that would be knee flexion. For knee extension, using blocks or barriers, boxes, any type of setup to help you kind of get into this position. Bend the knee just slightly, square your hips forward, and dorsiflex your ankle. From here, I'm going to just stretch and breathe. Try to keep my chest up and arch my lower back. Breathe and hold. Inhale 4, exhale 8. This will be my passive hold, 2 minutes. Making sure that you feel it only in the hamstrings, not the knee. If the knee is straight, you feel it behind the knee, that's your sciatic nerve. So you want to make sure the knee is slightly bent. You're getting all the hamstrings here. And then from here, after about 2 minutes, inhaling 4, exhaling 8, you press the heel into the ground, 10%, 20%, 30 to 40, all the way, working your way up to 100. And then Ral's contraction, pulling the heel off the ground, trying to shorten that distance, shortening your quad, extending the knee, trying to extend that tissue, and then after about 10 seconds of your Rals, come back to your passive hold. Hold your passive after that for about 30 seconds, and then switch. Holding here for about 2 minutes, making sure that you feel it. Remember, in the hamstrings, not the back of the knee. Arch lower back, chest is high. You can use, if you have a wall or any like 2 chairs, you could use as well here. And from here, pals, push the heel into the ground, Ral, pull up. That would be your pals and Rals and knee extension, okay? Now, as far as the hip goes, you get set up in your 90-90. Face the front leg, lean forward, chest is high. Push the hands into the ground, into the blocks. Passive hold here, 2 minutes. And then pals, press this front leg into the ground. Rals, pull up. And for the back leg, pals, press the whole leg into the ground. Rals, try to pull that back heel off the ground. So this would be hip internal rotation. This would be hip external rotation. Okay. All right, everybody. So that was a little bit of lower mobility work. That's gonna be it. I know you're just waiting over there.